Hi, my name is Kristina Huwer. I'm going to be doing our medication. It is Albutrol. So at this moment, I am going to be checking the MAR for the right route, the right patient, the right med, the right time, and the right dose. So my patient is Emily Hernandez. I'm checking Emily Hernandez. My medication is Pro Air Albuterol, and my medication is for asthma. My dose is 2 puffs 4 times a day, or 4 to 6 hours. Checking that is correct, and the right time is 1300. So I'm going to go ahead and I'm going to take my medication out of the MAR. Got it. It is the right medication. It is the right dose. So we're going to go ahead and go into our room. So hi, my name is Kristina. I'm going to be your nurse for today. How are you doing?
I'm good.
Great. I'm going to go ahead and wash my hands. I'm going to actually put on gloves. Perfect. And can you tell me your name, please, and your date of birth?
Emily Hernandez. I was born January 19, 1999.
Perfect. That matches my record. So I'm going to go ahead and I'm going to take a couple of assessments on you. Is that okay if I take your blood pressure and if I take your pulse and I go ahead and listen to your lungs?
Yep.
Perfect. So I'm going to take your pulse first. Perfect. I'm going to take your pulse. I'm going to take your blood pressure. Let's put this cup on. We're taking your pulse. Perfect. So at this point, we're going to go ahead and take a listen to her heart really fast. We're going to listen to her lungs. One more time. Breathe in, breathe out. All 8 spots. We're going to listen to the back of the lungs. The other side as well. Perfect. So I do hear the crackling and the wheezing in your lungs. So you definitely need albuterol. Do you have any idea of the reason what triggers your asthma? Like as an example, pet dander could be triggered by grass. It could be triggered by smoke, certain perfumes. It's also triggered by exercise induced as well. So with this medication, you should take it probably about 15 to 30 minutes before you do start exercising, so that you can make sure that your airways are nice and open. It also has some type of effects as well on your, whenever you have a cold, you have the flu, your asthma will trigger as well. So you definitely want to make sure that you always have your inhaler with you, okay? So the next time you do come to the doctor, we are going to want to know how many times a week that you are using your inhaler so that we can make adjustments if we need to. And we want to know if there's any type of difference in your activities of daily living, an example of your sleep patterns, or any type of more exercise-induced problems for you, okay? So we also want to make sure that if you do have any shortness of breath, that you do take a seat and relax and make sure you do have your inhaler with you, so that if you do need to use it, you have it readily available for you, okay? So, Emily, after going over that, do you have any idea of what it is that's triggering your asthma?
I think it's pretty much when I exercise, I just get shortness of breath and I start to wheeze a little bit. And when I was younger, I used to have asthma, but it kind of went away, but I think it came back. So I think that may be the issue.
Okay, perfect. So you always want to make sure that you do have your rescue inhaler with you at all times, just in case something like that does happen, so you can use it and feel a lot better, okay? So with this is going to be your albuterol. Albuterol is a bronchodilator, so it's going to open up your lungs and it's going to make you easily available to breathe. But there are some side effects with this, and the side effects are going to be a little bit of tachycardia, so you may feel a little bit of heart rate racing. You might feel a little bit of nervousness. You may feel a little bit of, nausea. Sometimes the patients actually have. So some of this can, over time, go away. And sometimes you do have a resistance to the albuterol, so you may need to assess this later on as well, okay? So I'm going to show you how to administer this medication right now. So this is your albuterol. It comes in this package right here. It does have the metered doses that you have here. You're going to go ahead and take this off, which is going to be where your mouthpiece is going to be. You're going to shake this, right? And you're also going to inhale this on your second part of your breath. So if you want to place your hand over your chest, and you'll be able to feel like your chest moving upwards just a little bit. So you'll feel like, so when you feel it expanding, it's when you want to go ahead and administer your medication, okay? So we're going to go ahead and we're going to do that right now. So go ahead and put your hand over your chest. Open your mouth. Perfect. And then hold it in for about 15 to 30 seconds so the medication breathes all the way down deep into your lungs. Perfect. And then for the next inhalation, I'm going to ask you to do it for me, okay? So you're going to go ahead and do the administration so I can make sure that I know that you know what you're doing. Perfect. Good job. So that was great, Emily. I'm going to go ahead and get you something to rinse your mouth out with. So here's a little bit of water, and you're going to go ahead and spit it into there. The reason that you're doing this is because sometimes the medication can cause some type of oral infections. So something like thrush or whatnot. So you want to make sure that you do go to the dentist at least 2 times a year, or even more often if you feel like you have something wrong in your mouth, okay? Perfect. So do you have any questions so far for me with your medications and how to take them or anything of that sort? No? So we do have a brochure for you. This is your albuterol. It's telling you what your albuterol does. It tells you your categories, any type of what happens in the event of an overdose, and anything that's going on with it on how to take it, your adverse effects and whatnot, okay? So your nursing interventions are here, your precautions are here, and any type of interactions. So there are a couple interactions that you can, your beta blockers and whatnot, but it's more like for, okay? So any questions that you have, please let us know, and we're here for you. We'll see you back in a week, okay?
Okay.